everyone, I'm Angela Seamster with Women's Health Physical Therapy and Men's Pelvic Health, and Ashleigh and I are here today to talk about our experiences during our pregnancies and answer any questions that you all may have. I've actually been working here since 2001. I'm a licensed physical therapist assistant and have treated many patients over the years, so hopefully, and I have 3 kids of my own, so hopefully my experiences can answer some of your questions.
Yeah, and I've been working here for coming up on 8 months now. And I'm, of course, some of you know if you're my patients, I'm also pregnant. I'm due at the end of August. So we're just going to kind of go over some differences between being pregnant and the postpartum period and what PT can do for you too during that period, both periods of time.
Yes. And if you have any questions during any of this, feel free. We have somebody that's looking at the laptop and can help us answer your questions. So let's go ahead and get started.
Okay, so we have a few here, but like I said, jump in at any time if you have any comments too. So pain, that's the first thing, pain during pregnancy.
Yes.
A lot of the time people have this notion that pain is normal during pregnancy, or there's pregnancy related pain that is normal. And granted, there is some normal level, I think, of pain when your body's changing that quickly, but you shouldn't have to have any type of chronic pain during pregnancy. So when you were pregnant, did you have any of the pains or aches or anything that were consistent with that?
I would say, well, for my first pregnancy, I guess I didn't expect to have any pain. And I was younger, I was in my 20s, so I did not have pain with my first pregnancy. But my second and my third pregnancy, I was in my 30s, and I guess I expected to not have pain with those pregnancies as well. However, I started to have a lot of SI joint pain. I had a lot of round, broad ligament pain. I also experienced a little bit of incontinence. But I was working here and had been working here at that time for about 10 years. So
you knew about all of that.
I did know about all of it, which was nice, because as soon as I started to have that pain, I was able to address it right then. And I think that's probably the biggest thing. Like, as soon as you start to have pain, you really do want to address it as soon as it happens, because the longer you let it progress, the worse it will get. So I think, just having one of the therapists check my SI joint, putting on an SI belt.
Orthotics, yes.
Yes.
Those are lifesavers.
Exactly. So, orthotics, right? To put in your shoes. The first one was easy. The second one had SI joint pain. The third one was joint pain everywhere, SI pain, and round and broad ligament pain. So so I just took precautions. Like, I put on the SI belts, and I did the exercises that I had been teaching patients for years. And within 2 to 3 days it was better. So I didn't have to wait 4, 6, 8 weeks before I started to feel better. It was very quickly. It was, as long as I was on top of it, I was able to get through the day.
Yeah. And I think the main thing from that is the preventative care. So, I might not have pain now, but I'm educated on what can happen to my body and what happens, and we all know, and getting the care or getting checked out prior to you having any of those things. Like you said, that third pregnancy, you were like, I'm ready to go. I'm wearing my belt, I'm doing the exercises, I'm stopping this from just even getting as bad as it did during the second one type thing.
Exactly.
I think that's the main thing too. Right now, being pregnant, I went through the same thing. I had a horrible coughing spell during the allergy season, and I had a diastasis open up from the coughing. I had stress incontinence during the coughing, and I truly believe if I was able to be preventative in it, it wouldn't have even have happened. And I work here, so but seeing that happen to myself was a good way to relate to patients as well, but then also really stress the importance of, let's stay ahead of these changes that are happening in your body so that you don't even have to worry about it and you can enjoy your pregnancy.
Exactly. And you'll hear your friends talk about incontinence and how it's so normal, for that to happen. I would disagree. Because I've had 3 children, and I don't have incontinence. I did have that pressure during the second pregnancy, and I had a little bit of incontinence, and I started to do those exercises, and it went away really quickly.
Yes.
And then I will admit this, I go to Sky Zone which I think a lot of moms probably
Yes,
do
they
with
do.
their kids. It's a big
Say that.
trampoline park, and I was jumping with one of my kids, and I had been jumping for like 20 minutes, and nothing had happened. And then all of a sudden, I did a huge, like, I was going to try to do one of my kids wanted me to do a backflip, and I thought, oh, I can do that. I used to do it when I was a kid. I couldn't, but in the end, I did. I had incontinence, and I thought, oh my gosh, like I know better than that.
You know?
I'm not going to do that. But I did have incontinence, and so the fascia, which is a part of the muscle that has no blood supply, and you can't really strengthen. I mean, with each pregnancy, it
Stretches more.
So I mean, there is, there's going to be looseness in that area. So I have a little bit of incontinence if I stress myself too much. However, doing those exercises ever since I was 18 years old, which has been quite a few years, and having 3 kids, I don't have incontinence every day. I can cough, I can run, and I don't have that. So I think it's really important that you start at a young age with those exercises, even before children, even before you start sports.
Yeah, even before, pregnancy and sports too. I've had patients come in who've had incontinence prior to having a child. So, I mean, it's there, it's prominent. It's just, unfortunately, our anatomy just sets us up for being a little bit more predisposed to that type of thing. So stay ahead of it. I think that's the main thing too. We hear from our patients when they come here, they're like, oh, I wish I would have known or done something, or at least had the information there so that I can get to it when I'm ready.
Right.
So that's a big thing.
And know that you are not the only one. I think I've heard that so many times over the years, that women come in and they just say, I just feel like I was the only one. With pain after pregnancy, with pain during pregnancy, with incontinence, you're not the only one. We have been doing this for many, many years, and we see lots of patients every day. So just know that we are here, and there's lots of other women that are experiencing the same things that you are, and we're here to help.
Definitely.
Okay, so
there's more stuff. We have stuff here, and again, if you guys have questions, just holler out. Meredith's watching for us so that we can answer those for you. So let's go into exercise preferences. I feel like a lot of women come in and they're like, what can I do during pregnancy? What can I do that's safe postpartum? Or even if you're feeling really good, like what's safe to do postpartum? And I think the main thing that I express to people is taking care of your abdomen and taking care of your diastasis. And diastasis and pelvic floor go together. So taking care of both of those things. So anything that you were doing before that stressed that, I always kind of encourage people to slow down in that department, even if you are feeling good, so that you don't, I say, this is a terrible analogy, but like knock the kid off the bicycle multiple times. They're already struggling. You don't need to give anybody a push when they're already struggling. So to kind of take care of those things and I don't want to say baby them, but be kind to them during this time period, because it's when your body went through all these changes. But I know people don't like to hear that.
Right.
So people want to keep doing what they've been doing before. So it's hard.
So it's really important to protect your core. So, and that's like a whole other video. We can't really go into exactly what that is. But protecting your abdominals and your pelvic floor, so your entire core, it's really important during pregnancy, and just making sure, that you can still work out. There's yoga, and there's prenatal yoga, there's prenatal Pilates, and walking. There's lots of things that are safe exercise-wise to do when you're pregnant, but definitely protecting the core is the biggest thing.
Yeah,
I would agree.
It's huge, and I know I can't say anything to this yet, but a lot of women will go and do things during their first pregnancy and feel okay, and be like, okay, I was running until 34 weeks without any support externally from an orthotic or anything, and I was doing planks and crunches or whatever, and people can still do that, but it's not taking care of it afterward, or making sure that the musculoskeletal system is intact again after that. And then the second pregnancy comes along and people are like, whoa, I can't do this again. And it's again that same concept. It kind of puts you back a little bit more than you think it would. You just don't know you're compensating yet until it's back enough that you realize, oh, I've been compensating this long for these problems.
Exactly.
So,
and also, again, kind of going back to the fascia, and that covers our muscles, it stretches. So, I mean, it's going to stretch during every pregnancy, and so you don't have that support system. And so you really want to make sure that when you're out there and you're doing those exercises, you have the mother-to-be belt, you have nice support on your body, so that when you are exercising, you don't put as much stress on those areas. So, again, another thing that we can be here to help you with, for sure.
Definitely. There's tons of external support belts out there, and you can order them off Amazon, you can get them from us. I mean, there's tons of places, but there's ways to put them on too that help benefit supporting your abdomen and your pelvic floor, and we can definitely help with that too.
Exactly.
So there's also tons of exercises, and like she said, this is almost a separate video that you definitely should avoid during pregnancy. And if you're wondering about those, definitely call us and make just at least a screening so that we can go through those, so that you can prevent things from happening again, or prevent from happening them in the first place. Okay, so a couple more things. So key points to convey toward first-time pregnant women. So we had a patient kind of give us some points that she wished she would have known when she was going through her first pregnancies and experiencing pain. So one of them was to just seek help sooner. Like Angie said before, there's this, I think, idea around having incontinence is normal or having pain is normal, and that's definitely not something that's normal or you need to deal with. So getting help sooner, not waiting, until your third trimester if it starts hurting, at 18 weeks, or not waiting 3 years postpartum when you have these problems, you notice them at 6 weeks and they didn't get any better type thing.
Okay, let's see. Do we have some questions we're going to answer? Okay, so we have some questions from some people who weren't able to tune into our live video. So let's see. 1, do I need to work on my pelvic floor and abs for each pregnancy? So yes, you definitely need to work on pelvic floor and abs for each pregnancy. It's going to be better if you work on the pelvic floor and abs prior to pregnancy, just to kind of prepare your body for pregnancy and for labor and delivery. But again, they are specific exercises. You want to make sure that you're not doing anything that's going to harm your body or be harmful to the baby. You want to add anything?
Definitely, and I encourage people, for each pregnancy, preventative. Do it beforehand. But during each one, because each one is so different, as Angie talked about earlier. Each one is so different, and everybody is so different. So working on it before and during, yes, of course, and safe if you're a high risk or anything like that. Of course, we need to take all that into consideration if you're on bed rest. But working on all of that during is super important.
Right. Okay, number 2, during pregnancy, when should I come for PT? I would say to have just a screening as soon as you're pregnant would be great, because then that gives us a baseline as to where your musculoskeletal system is at that time, and address any issues that may arise in the future.
Yeah, definitely. I totally agree with that. And we always tell people, even if you're feeling really good, like you're like, I feel awesome, coming sometime during the first trimester, get the info, know what a diastasis is, know where your pelvic floor is, know what it feels like to do pelvic floor contractions correctly, know how to check your own diastasis, and then come back in the third trimester, check again. If you're good to go, yay.
Right.
Then you're good to go. But that's 2 visits through 9 months if you're doing well, and either way, it's good to just get everything looked at.
Exactly. Okay. 3, how long does a diastasis take to heal? Do you want to start with that?
Yes, I definitely can. So we get this question a lot because people want it. Of course, you want it to close right away. Everybody wants it to close right away. Usually, it depends on when you come here, how severe it is, of course, and also depends on the person's body. If you tend to be somebody who has really tight abdomen or has really tight fascia, or on the other end is very lax, all of that plays a factor into how fast the diastasis closes. how adherent you are to your exercise program that we give you, of course.
That's a big one.
Yes.
And you have to do your exercises.
You do. I say if you just like 80% of the time that I tell you to do them, that usually does a good job.
Yes.
And then avoiding the bad things.
Right.
All of the bad things, the crunching, the plank, all of that stuff plays into that. So doing the homework, avoiding the bad things. And most of the time you can get it closed. I would say if I had to give a time range, like 3 months, usually I see people get it to a place where they're cosmetically and functionally happy.
Yes.
But again, it's different for everybody. It could take a month, it could take a year.
Right.
You know?
I usually say if they are compliant with their exercise program, they usually start seeing changes around 4 to 6 weeks. And then, yes, 12 weeks is usually, if you're compliant, the end of the treatment.
Yes.
For that particular diagnosis. Yeah. Okay, 4. Can my pelvic floor be weak even after C-section? That is a really good question. Very good question. Do you want to take that one? You want me to start?
You can start.
Okay, so yes, absolutely it can. It's not just with vaginal deliveries. C-section deliveries, you think about carrying a baby for 9 months and the pressure that puts on your pelvic floor. So again, your muscles are stretched, your fascia is stretched, so there's weakness there. So you can have all of the same symptoms as someone who has a vaginal delivery. There is no difference.
Yes, definitely not. And then there's also usually scar tissue from the C-section, which also affects your pelvic floor. So there's a little added component to that as well. So definitely, I agree completely.
Yeah, absolutely. Do we have any more questions coming in?
We have one. We have a comment. So I'll just read the comment and then we can kind of answer and chat about how we would deal with it. So she says her daughter-in-law had a baby at the end of April. Her entire left side hurts and she tried physical therapy but did not get a lot of relief from it. So I hear that a lot, unfortunately. And it might be, and if you're still tuning in and you can answer, you can tell us whether she went to a pelvic floor physical therapist, so somebody that was actually maybe looking at the actual postpartum impairments and not just looking, I mean, we look globally all the time, but looking, at the actual changes that happen during pregnancy and the postpartum period. Right. That would be helpful to see if she actually went to one of them. Either way, if one PT or experience with PT didn't work, if it is musculoskeletal, she probably needs to come back and see another one. So I encourage her to come see us again, even if it's just for that postpartum screening. Right. We can figure out if it is musculoskeletal or if she does need some other type of interdisciplinary work done to help her with her pain.
Exactly. And, finding a physical therapist that specializes in women's health physical therapy, because physical therapists, just like physicians, there's tons of different specialties. There's neurology, there's acute care, there's orthopedics, the list goes on. And so it would be a women's health physical therapist that specializes in that particular,
that department.
Right.
Especially if she feels like it was something that came on after her pregnancy and in the postpartum period.
Exactly.
All right.
I hope that was helpful.
Yes.
Let's see, what else, other questions do we have?
There's one on, you did a good job taking care of your pain throughout pregnancy, which is good. I think a lot of the time, like I said, I guess the normalcy of the whole thing doesn't lead you to that. So a lot of the things we had written were, did you have pain during pregnancy and what did you do? So if you guys had any pain, please share. We would love to talk about it.
Right, exactly.
Otherwise, that other paper has something on there good from that patient.
Okay.
Yeah. This one made me laugh. The Kegels really do work.
Yes.
To them.
Yeah.
I think a lot of the time people will come in and they will say, like, I've been doing Kegels for 6 months.
Right.
Postpartum. And I've had stress incontinence and they've done nothing for me. Like, nothing has happened. And I think when you come here, we give you a lot of information. But a lot of the time people forget that the abdomen matters in the function of the pelvic floor. And then on the other hand, a lot of people come in, and when you come in, we assess your pelvic floor muscles, and we find out that a lot of people aren't actually doing Kegels correctly,
Right.
or that Kegels are not for everybody. Like
Yes.
sometimes you should not actually be doing Kegels. So taking that, you know, and saying pelvic floor PT is only Kegels, you know, there's a lot more to it than that, and then Kegels might not be appropriate for you if
Right.
you have been doing them and there's been no change in your symptoms.
Exactly. And there's 2 sets of exercises for the pelvic floor, and a lot of people don't know that. And so making sure that you can contract both sets of muscles in the pelvic floor, that's really important. And I would say probably 50%, maybe even higher, of people that I see actually are not doing the Kegel
Yes.
exercises correctly. And it's important to be able to do that correctly in order to gain, you know, to progress.
Exactly.
So, okay, let's see. I think there was key points to convey for first-time pregnant women. I think we touched on that a little bit. You know, just making sure that you get in here as soon as you can and educate yourself about what's going on with your body. Take your classes at your local hospital.
Yes.
That's really important. That's out of our scope of practice, but they have breastfeeding classes. And, you know, the first day you get home, days 1 through 3, what to expect. And for me, I think it's kind of funny. I wish somebody would have told me like what to expect when I got in the shower the next day after I had a child.
Share.
Yeah. So what your stomach looks like, you know, it was like a bowl of Jello, and I thought, oh no, like is it going to stay this? But it doesn't stay like that.
Good. Thank you for telling me.
And that I was going to have to, you know, wear pantyhose that were like fishnet underwear, and you know, these are kind of things that women don't know and don't know what to expect. I mean, there's going to be pain in the pelvic floor, and you're going to be given medicine that's in the form of foam and tux pads that go onto these large pads that you'll wear for the next couple of weeks. And so those are important things to know and to be able to expect and say, okay, like that's normal. Like I'm not. This isn't strange. Like this isn't something that only pertains to me. So those are a few things that aren't really physical therapy related that I think
good to
are
know.
important to know.
Definitely
so
good to know.
I think we've covered pretty much everything.
And
I do want to say one other thing, and again, this is out of our scope of practice, but because hormonally your progesterone and will drop dramatically as soon as you deliver. A lot of women suffer from postpartum depression, and though we don't treat that here, I think it's really important that you talk to your doctor about that as soon as you see it or feel it. And it comes in lots of different forms. It can be crying and sleeping or
anger.
So please know that many women suffer from postpartum depression, and I had that severely on my last pregnancy, and it's just really important that you talk to your doctor about that, because there are treatments and there is help for that.
Definitely.
So
Great.
I think do we have any more questions? Okay.
Just one more? Okay.
Cool.
All right. So she is, okay, so this one is 6 months pregnant, and I'm sure it's not too late. It's not too late. I already read that. I haven't read the question, but I still benefit from seeing a women's health physical therapist at this point. For sure.
Absolutely. Hi, Jessie. I actually know this wonderful woman here.
Okay.
So yes, absolutely. Of course, we want to check for your diastasis, and we're going to check your pelvic floor muscles for tightness or weakness, and just check your, musculoskeletal system and see if there's anything that we can do to help support you during pregnancy.
Definitely. Even if you're not having any problems, like we said earlier, just coming in to get the education on it is really important.
Yes, absolutely.
Cool.
All right. Cool. Well, thank you all, and we, if you need any help, please give us a call. Email us. We're here to help you.
Yeah, and you can always reach out on Facebook as well.
Absolutely.
All right. Thanks, guys.
Thanks. Bye.